Hello and welcome to the Presidential Medical Debate. I am your moderator, Ryan Seacrest. Today we have a great debate planned between presidential hopefuls Donald Trump and Hillary Clinton. Let's introduce the subject of our debate tonight. She's our patient, Samantha. Now, as our sample is sent to the lab, let's introduce you to our doctors. He's been on such hits as The Intern, and everything he touches turns to gold. You know him. You love him. He's our MD. He's the Donald.
Hi, I'm Donald, and I'm going to make healthcare great again. And I guarantee it's going to be a success.
And now our second participant. You may know her from such scandals as Monica Lewinsky and the top secret email servers. She's our pharmacist. She's Hillary Clinton.
Yay! Yay! Thank you. I took on Wall Street, and I will do the same for your illness. My persistent dedication, and despite the complications of the past, I will still take healthcare to a new level. I have the experience. Don't worry, I will take care of it.
Okay, Hillary, let's not get ahead of ourselves. I think everybody knows what you represent. Let's just get into the case we have in front of ourselves.
All right then. Let's take a look at what we have.
Okay, it looks like we have a great debate ahead of us, folks. Our first question is, what is wrong with this patient? Miss Clinton, we start with you.
Well, let me see. She's on a gurney and she's under a white sheet, so I'm going to say that she's sick. She's probably sick, yes.
You are a moron.
I mean, this poor patient, look, I mean, there's some kind of infection going on. I'm very concerned for this person, and I will do whatever it takes to make this person well.
Oh, gee, thanks. That's very nice of you.
All right, how about we look at that chart?
Oh, look. It's not marked secret. Does anyone care to see? Okay. It says that looks like it's infectious diarrhea. There's been stools for 2 days now, and there's been 7 episodes per day, and there's a slight fever, 101 degrees. It's got to be infectious diarrhea. Well, more diarrhea. Yes, infectious diarrhea for sure.
Oh, that reeks. I know my crap. That is not infectious diarrhea. That is C. diff.
I have no doubt that you know your crap, but you can't possibly know what kind of crap just from the smell.
C. diff is very distinctive. And I've smelled a lot of crap in my day. Let me tell you, this crap is the kind of crap you don't want to take home to your mama.
Now, I have seen a lot of rectal discharges, but this one is particularly watery and thin, and I stand by my original diagnosis of infectious diarrhea.
Well, all I've got to say is I've yet to fail at any diagnosis. And this one is sure to be C. diff. I mean, look at the consistency. I'm going to have to push for smell-o-vision or something. Trust me, folks, if you could smell it, you definitely diagnose it as C. diff.
And the labs just came back. The GDH test was positive. The EIA test was negative.
We don't need to know anymore. If it smells like crap, it looks like crap, and has a consistency of crap, it's C. diff.
The PCR test just came back. It was positive.
And that's a confirmation. It's C. diff. See, I'm always right. America, don't worry. I'm going to take us in the right direction.
Next up, we need a treatment. Wait, Miss Clinton, what are you doing?
Nothing. I mean, I was told I should wipe my servers, and I needed to do that.
Anyway, on to the treatment. Dr. Donald, you're up.
Well, it's easy. There's only one thing you do when there's diarrhea. I always give a Z-Pack. It's cheap, it works, and it's how we're going to make healthcare great again.
That's not how you treat C. Diff, not with a Z-Pack.
What? Of course it is. I use Z-Packs for everything. There's no infection I've met that hasn't been taken care of with a Z-Pack. Just let me do my job and get out of here.
I don't agree. You don't use a Z-Pack for C. Diff. For C. Diff, you use Flagyl.
You leave my Flagyl out of this. There's nothing wrong with my Flagyl, and I have the hands to prove it.
What is it with men and their Flagyls?
Well, why don't you go ask Monica Lewinsky?
Okay, Trump. We don't need to talk about each other's Flagyls.
Oh, so you admit you have a Flagyl?
Oh, please. Stop the games.
Oh, this isn't Libya Clinton. There's an innocent life at stake.
I'm not the one who wants to dispense a Z-Pack. According to the IDSA guidelines, an initial infection of C. diff should be treated with 500 milligrams of metronidazole 3 times a day for 10 to 14 days.
All right. You might be right. But you messed me up.
I messed you up?
Yeah! You started talking about infectious diarrhea. That started me thinking about Z-Packs. Then you bring up my Flagyl. It's all your fault.
So, is there a consensus?
500 milligrams metronidazole 3 times a day for 10 days.
All right, well, you have successfully treated this patient.
Carson isn't the only one who can treat a patient.
Congratulations. You have not properly covered yourselves or used gloves. You are now both potentially infected too.